Hi, my name is Chloe Green, and this is my DMP presentation on the implementation of a discharge trauma nurse. First, I would like to thank the members of my committee for their roles in helping me complete this project. My chair, Dr. Heinrich, for consistently providing me with constructive support and assistance since the beginning of this project. My community member, Ashton Marsh, for the support and providing me with resources throughout the project as well. I would also like to thank the second reader of my project, the director of the DMP program at Maryville University, Dr. Snell, for her dedication in ensuring that all DMP students at Maryville University are supported and successful in this program. Background. In evaluating the discharge readmission risks and 30-day readmission rates, discharge trauma patients are among high risks. Increased 30-day readmission rates for trauma patients increases workload of nursing staff, physicians, hospital reimbursement, and patient complications. At discharge, there is a large amount of information and education that is involved in a trauma patient's transition from hospital to home. Significance. Identifying patients at higher risk for failure and complications can help professionals target these patients with implementing a more appropriate plan, Whiting 2015. NARE 2020 animates that making contact with patients early, education post-discharge, and a discharge appointment within 2 weeks of their discharge leads to substantial readmission reductions of heart failure patients. These reduction in readmission rates in other areas, such as orthopedic trauma and eventually even other specialties, will be significant to nursing practice as a whole. This will provide evidence to change how we provide transitions of care. Readmissions can be due to lack of pain control, a lack of education for care at home, complications, or infections. My goal was to implement a discharge RN who would ideally reduce these overall complications, overall cost of care, burden on staff and patients' families, and readmission rates. Purpose. The primary aim of this project was to reduce the 30-day readmission rate of trauma patients by implementing a discharge trauma nurse. The discharge trauma nurse would implement a 3-day post-discharge phone call. This would lead to decreased patient complications, increased patient adherence, and education. The personal interest in developing this research study stemmed from my experiences working as a bedside nurse at the facility utilized in this project. I worked on the orthoneurotrauma floor that was already known for being physically and emotionally taxing to nursing staff due to high patient acuity and complexity. Readmissions adds to patient, family, and bedside staff stress and the facility's burden of ratings and reimbursements. Zell 2015 encourages the use of a discharge RN follow-up with the statement that established protocols for discharging trauma patients can improve noncompliance. The purpose of this project is to provide evidence that a discharge nurse providing a phone call 3 days post-discharge will improve the trauma readmission rates. There are many studies that support the implementation of a follow-up connection and the problem that it's addressing. A follow-up by nursing staff is shown to reduce hospital readmissions by increasing compliance, catching complications and issues early. Patient Engagement, HIT 2019. This change starts at changing how we discharge and follow up with trauma patients. I wanted to revise a policy that benefited staff, patients, family, and the facility, allowing for a higher quality of care and transitions overall. Review of literature. In reviewing the literature for this project, there were three major themes identified. First, risk factors. The second is transition of care. And third being resources. These three themes were essential in guiding the research that built this project. Each theme directly related to the aims and purpose of the project. The literature used in this project all had their own strengths, weaknesses, and limitations. There are a few noted gaps in the literature. However, the articles were selected based on their relevance to the project's PICO question, the purpose of the project, and their potential contribution to the research needed to implement the discharge trauma RN. A few of the strengths noted in the literature was that research was evidence-based and unbiased. All the research articles utilized in this research paper are of high quality and free of any delinquency. All were conducted with a commitment to ethics and as primary source evidence. It is a notable strength for articles and studies to be performed without any conflict of interest or gaps that are noted. Pollitt and Beck, 2021. All studies showed verification for approval of study and showed no legal altercations. There was also case control research included in these studies, and that is also considered a strength. An identified weakness in the literature was that multiple settings and some studies utilize linear designs, which can be considered weak when compared to longitudinal designed research. In addition, some studies had limited sample sizes, which is also considered a weakness. The theory utilized for theoretical framework in this study is Melissa's transition theory. This is described as a transition event to response to meaning to level of well-being. The transitions theory illustrates the nurse's role of guiding patients as they go through illnesses and life transitions. It focuses on nurses facilitating healthy transitions for the patient, community, and families. This is relatable to the project about the transition from hospital to home. The smoother the transition, the reduced number of complications and readmissions for the patient. Other transitions and propositions within the theory is Dr. Melissa's stand in supporting nurses' role and concerns. Part of the main theory framework supports nurses' concerns about changing systems and challenging nurses to develop therapeutic interventions. Dr. Melisse also specifically addresses situational transitions, including discharge and relocation transitions, where she mentions how highly nurses are relied on to coach and support patients in these transitions of care. Melisse, 2010. Methodology and design. This project utilized a longitudinal pre-test and post-test design over the course of 3 months. This study was performed in a large Midwest facility. The hospital is a level 2 trauma center with 343 beds. The retrospective chart review required support from the facility's IT department, manager, director, and chief nursing officer. The computer utilized to access these charts was provided by the facility, and the laptop utilized to document the data on the data collection sheet was already attained by the author of this project. All patient identifiers were removed and withheld and protected throughout the study. The design of this scholarly project is a qualitative pre-intervention, post-intervention design with the use of a quantitative data comparison design. A retrospective chart review was utilized with no patient engagement. Data was collected using the data collection sheet to compare the two variables nominally. Demographic attributes were also collected, such as age, race, and gender. The dependent variable is the 30-day readmission rate. The independent variable is either the pre-intervention chart group or the post-intervention chart group. The data collected was the 30-day readmission rate of 77 patients, 77 charts pre-intervention, and the 30-day readmission rate of 77 charts post-intervention after meeting the inclusion criteria. The author of this project had verbally discussed the project in training with all staff involved. A log linear regression model and a lower tail z-test was utilized to determine significance due to comparing two variables. Participants' identity remained protected through the entirety of the study, so no consent forms were required. The project did gain Institutional Review Board approval from Maryland University. A total of 154 charts were reviewed, 77 pre-intervention and 77 post-intervention. The sample consisted of 40% female patients, 59% male patients, and 1% other. All ages of the participants ranged from 18 or older. The participant group consists of a racially and ethnically diverse population. The ethnic backgrounds of the patients included in this sample included 23.4% African American, 61% Caucasian, 11% Hispanic or Latino, 4.5% Asian, and 0% other. Data analysis. The sample consisted of 77 patients admitted to the trauma service prior to implementing the intervention between February 1st, 2024 and March 1st, 2024. The intervention of a discharge trauma nurse was implemented on February 16th, 2024. The second group of charts reviewed were between the dates of March 2nd, 2024 and April 2nd, 2024. The evaluation of the implemented intervention was performed by a retrospective electronic medical record review to compare the readmission rates prior to a trauma discharge nurse. All data was uploaded to an Excel document on a private, password-protected laptop that did remain at the author of the project's residence until all data was collected. Statistical analysis using the statistical package of social sciences, or SPSS, was utilized to compare the means and standard deviations of the 30-day readmission rates. The Quality Improvement Project utilized a retrospective chart review to evaluate the quantitative data to determine the impact of the intervention. The statistical test to analyze the data was the z-test for the difference of two proportions, a special form of chi-square. Results. A lower tail z-test was utilized to display the difference of two proportions of the 30-day readmission rate without a trauma discharge nurse compared to the 30-day readmission rate with a trauma discharge nurse. Although there was a decrease in the 30-day readmission rate, visualized here with the pie graphs and the percentage, the z-test indicated that the difference was not statistically significant between the two groups. The log linear regression model determined the 30-day readmission rate was also not statistically significant. The logarithmic regression equation is y equals 0.0778x plus 0.4012. The value of x is the predictor variable. The value of y is the slope. In order for this to show regression, the slope needs to be in a negative value. In this case, it is in a positive value, showing no regression, also displaying that it is not statistically significant. Limitations. This study had a few limitations. The first being the duration of the research over a 3-month period. A longer data collection period may have been beneficial to allow for statistically significant results. The second limitation was the limited sample size. Preliminary analysis completed by Maryville University's statistician, Dr. Mark Pauls, suggested that for a sufficient power to be achieved, a sample size of 154 charts was recommended, 77 pre-intervention and 77 post-intervention. The limited control of the nature of variables could have also been a limitation. This was not included in the exclusion criteria, which could allow a more concise result of specific traumas and lengths of stay. Lastly, the resignation of a physician during the data collection with the possibility of impacting patient census was another limitation noted. The census compared to prior resignation of the trauma physician was not collected. The impact of this limitation is unlikely significant, however, does raise a concern for data limitation. Discussion. It was expected that this study would show a significant decrease in the 30-day readmission rate. A limiting factor of this study includes time. Vernon, 2019, performed a research study showing if contact with a community nurse after discharge reduces the readmission rate of patients. The results of this study did display a statistically significant reduction in the 30-day readmission rates after a nurse made contact with the patient after discharge. Vernon 2019 analyzed this data over a 6-month period versus the data of this study performed was a 3-month time frame. There was also the inability to control nature and variables such as weather conditions contributing to increased traumas, types of trauma patients admitted, severity of trauma patients. A more concise study could be performed focusing on specific types of trauma patients. For example, motor vehicle accidents and the impact of a discharged trauma nurse on the 30-day readmission rates of these specific trauma patients. Although limitations present, after data collection, nursing staff and physicians reported noticeable difference in quality of discharge education and patient confidence, which is not captured in the data collection tool. Implications. The implementation of a trauma discharge nurse can be effective for the facility staff and patients in reducing complications and readmissions. Other benefits of this study are improved patient satisfaction, government and insurance reimbursement, and improved nurse workplace satisfaction with a decreased burden and workload. NARE 2020. Future research should focus on the benefits ultimately being cost-effective for facilities in the long run. These benefits include improved nursing staff satisfaction, promotion of the patient's health, and enabling the patient to utilize adequate resources. Jonas Datier, 2016. Conclusion. This study found that the implementation of a discharged trauma nurse that makes contact with the patient 3 days post-discharge, post-intervention does not have a statistically significant impact on the 30-day readmission rate of trauma patients. It should be noted there was a decrease in the readmission rates over the 3-month period. However, it was not statistically significant. While limitations and barriers were encountered in this research, further research, improvement, and implementation could statistically benefit the 30-day readmission rates. The process of implementing my DNP project into practice was challenging and extensive. However, I thoroughly enjoyed it, and it has allowed me to grow as a nursing professional and as a scholar. I would like to thank all of the professors I've had the pleasure and opportunity to work with throughout the duration of my DNP project at Maryville University. Here are my references utilized in this presentation, and at this time, please feel free to ask any questions. I appreciate your time and attention throughout the presentation. Thank you.